Today, in the series of Docplexus KOL interviews, we have with us a person who needs no introduction. His yeoman service in the field of community healthcare fetched him the fourth highest civilian award in the country, Padma Shri. We have with us Dr. Abhay, who has changed lives of several women and children in Gadchiroli. Welcome, Doctor. Doctor, you have worked for nearly 3 decades in Gadchiroli, and it has changed the infant mortality rate there, but still there continues to be a lot of problems. Could you tell us about those issues that you think you would want to address?
Gadchiroli is a very remote area of the Maharashtra state. Enormous poverty, half of the population is tribal. So naturally there are a large number of economic, social, cultural issues there. Lack of education is one of the most important. We have focused on the issues which people told us that they want some solution.
Mm-hmm.
And so one of those problems was our children die.
Okay.
Can you do something? And so as a doctor couple, Rani and me, started working on those issues. I'll come to what we did to reduce child mortality subsequently. But first thing we did was measure how much is the problem. And in 100,000 population, we measured for 1 year in 1988, and the infant mortality rate at that time there was 121. And 3 major causes of infant deaths were newborn deaths, childhood pneumonia, and diarrheal disease. So it is these 3 problems on which we have focused our attention to reduce child mortality. But apart from this, there are several other health problems. Women have gynecological problem. There is severe child malnutrition. Malaria, tuberculosis is prevalent there. And past 10 years, we are witnessing now change in the disease pattern, and high blood pressure, diabetes, stroke, heart disease, COPD, these are emerging, cancer,
Okay.
and addiction.
Okay.
These are now gradually increasing.
Mm-hmm.
So in a way, this area is facing a triple burden of disease.
Mm-hmm.
The earlier malnutrition, infection, mortality continues, but at the lower level.
Okay.
The chronic non-communicable disease,
Mm-hmm.
and then addiction and mental health problem.
Okay. So you started off with the concept of home-based newborn care after looking at the infant mortality rate. That brought down the infant mortality rate to a great extent. How do you think it can be, disseminated to other parts of the country, world, internationally?
Look, every year about 20 million babies are born in rural India. In 1990s, we realized that these babies are high-risk babies. Most of the child deaths occur actually in these babies' first 1 month of life, and they have nowhere to go. Now, because they couldn't go to hospitals and hospitals were very few, we decided that we will change the model and we'll provide health care at home.
Okay.
So we developed a model which we call home-based newborn and child care, in which we first take community's consent and then select one village woman to become a community health worker. We call her Arogya Doot, train her to become a community health worker, competent, and she then starts visiting during pregnancy, during delivery, after delivery, make 8 home visits to newborn care, and then helps mother, educates mother how to provide newborn care, identifies risk factors and sicknesses in newborns, and treats them. Now, this home-based newborn care has been extremely effective in reducing newborn mortality and infant mortality, to the extent that the infant mortality, which was 121 in 1988, reduced and finally settled down around 26.
Mm-hmm.
So 121 to 26, nearly reduction by 100 points. That is what the communities, the people, community health worker, and any model which builds up strength of community health worker and village community could be able to do.
Um, Sir, one important factor in the success of this project was you being able to create awareness among the women there. You made them as the health worker there and then got your project disseminated. So, can you talk to us about the awareness levels that you need to provide to people?
Look, people have their own traditional belief systems and
Okay.
practices,
Okay.
and these must have been based on some past experiences.
Mm.
Some of them must be valid, some of them may not be valid.
Mm.
But science has now given us more insights about why diseases are caused.
Yeah.
And so, to me, the most important vaccine for all health problems is knowledge vaccine.
Okay.
Create awareness and give knowledge about of the science of why the disease is caused, how disease could be prevented, and if at all you develop disease, what to do. That is one most important thing. Second important thing is build community efforts.
Mm. Mm.
People live in communities. They don't live in isolation on Mount Everest. And so their every action is a collective action, and they can strengthen each other, support each other. That's how people live in villages. So strengthen communities, involve communities. And third is, which I already mentioned, this community health worker is a great concept. That woman is from that village itself, or that man is from that village.
Correct.
You don't have to implant it from outside. Doctors don't want to go and live in villages. They are accustomed to urban life. Now, why make that poor doctor unhappy by placing him in village where he doesn't want to live? Transfer some of his knowledge, some of his skills and roles and responsibility to a community health worker, which she happily does. She does it more effectively because she is actually living there all 24 hours, 12 months in a year. And so, knowledge vaccine, involvement of communities, and community health worker. These three are very important. Primary healthcare, doctors, hospital, healthcare systems are primary to support these things in the community.
Okay.
So solutions are there in community. We need to strengthen those people and develop their capacity to implement those solutions.
Doctor, your studies have also found that there is high prevalence of gynecological problems in rural areas. Now, what should government or what should the establishment do about resolving this?
In 1988, we did study of 2 villages. Look, study of gynecological disease in rural communities is a very sensitive matter. Nobody wants to talk about gynec problem. It's a shameful thing to talk about. And so, with great difficulty, we could convince women, all women in 2 villages, to get examined. And my wife is a gynecologist. And we found that 92% women in rural areas, in that area at least, had gynecological problem.
Okay.
3.6 problems per woman. So large number of hidden morbidity. On one side, we published this study in the Lancet. Later on, it acquired international attention, and the concept of reproductive health. One of the trigger was this study that women didn't need only family planning, but they needed complete reproductive health care. At the local level, women needed knowledge. As I talked earlier, there are a lot of misbeliefs, misconception about sexual and reproductive health problems. And so, through programs, we educated women about science of their reproductive organs and reproductive health care, gynec health care. Secondly, because old women, their ideas, it was difficult to change, we started with younger generation, a 3-day workshop, and so far we have trained thousands of young girls and boys about reproductive sexual health. And those women who still have gynecological problem, because there are no lady doctors in villages and women won't go to a male doctor, we trained at that time in 1988 traditional birth attendants. We trained them, they were conducting deliveries, but we also trained them how to manage gynecological problems. And then finally, some of the women would need more advanced care. So we have established a gynecological clinic and gynecological operation program for the problems like, let's say, prolapse uterus or severe menorrhagia, large fibroids. You need hysterectomies. So the whole range from knowledge to young generation to hysterectomy, the whole range of program of gynecological health was developed in Gadchiroli.
Since there are cases of sexual violences in rural areas, generally there is lack of awareness among parents or the victim herself. So, what steps should they take? How should doctors be sensible? What kind of rural health? How can rural healthcare be improved in that setup? Because we're still lacking in providing basic care itself.
In general, we in India, we the medical community in India, are not very much aware of this kind of possibilities, sexual violence against children. Maybe it didn't occur much in this country, or it occurred, but it was never taken to the medical profession. It was hushed up. So we are not during our training, we are not taught these issues.
Okay.
First thing we must see is that if a child, even if an adolescent girl or woman, appears depressed, appears disturbed, or behaves differently, we must suspect that this possibility. So, high index of suspicion is something which is very important. As studies after studies have shown, 90% of rape cases, the perpetrator is a known person. He's not stranger or outsider who comes and rapes the girl. And so it is the relatives or the close people around or the neighbors, and that's the child is further afraid to reveal the name because the person is right there. And so the confidentiality, giving confidence to the child and to the family. Doctors not only should ask this question, do very sensitive and empathetic medical examination. The person, the victim at that time, is both in physical as well as psychological agony and shame. Unfortunately, as that girl yesterday said, the person who was raped by Asaram Bapu, she probably said that I shouldn't have been hiding my face actually. It is the person who committed the crime should have been hiding the face, but it was other way around so far. That's reality. That the victim feels ashamed and guilty, and so we need to give psychological support, social support, institutional support to these kind of girls. Gradually, with if this epidemic of violence against sexual violence against women, if it doesn't abate, then we need to probably develop both institutional mechanisms to provide support and even rehabilitation to these women, especially the girl child.
Okay. So, thank you so much for joining with us, Dr. Bang. It was an insightful discussion with you. Thank you so much, Dr.
Thank you, Adarsh.
Thank you, sir.